Without the organ donor, there is no story. No hope, no transplant. But when there is an organ donor, life springs from death, sorrow turns to hope, and a terrible loss becomes a gift. This is quoted by Eunice. How would you feel if your doctor told you that you only had months to live unless a heart became available? Now you're placed on a waiting list with many others waiting for your new heart. Today I'll be discussing the topic of organ donation. Who can donate, the reasons you should donate, as well as myths that go along with it. I'll also give you some reasons you can register to become an organ donor. Organ donation is a way to save a life. No matter how old or how young you are, you can become an organ donor. The number of patients waiting for an organ is greater than those who actually donate. According to organdonor.gov, 23,219 people are waiting for an organ, and 21 people will die each day waiting for the specific organ that they need. Organ donors can save up to 8 lives. Anyone can become a donor. There are very few medical conditions that can disqualify you from becoming an organ donor. Even though they may not be able to use one of your organs because of disease, they may be able to use another. Some of the disqualifications include if you are HIV positive, have a systemic infection, and/or have active cancer. If you need an organ, you're placed on a waiting list and can wait up to months or years for your organ. The order on the list depends on the chance of survival and the most critical patient. They take into consideration a medical emergency, body size, blood type, and geographical location. Organs that can be donated include your heart, lungs, liver, kidneys, intestines, skin, and cornea. Organ donation is usually the last choice of treatment. There are myths regarding organ donation, and one includes if you are working in healthcare and you're in really bad shape and you are not an organ donor, the doctor will not do everything they can to save your life. This is false. They will do everything. They have to take care of you before they can take care of somebody else, and the doctor takes a Hippocratic oath that means that they have to save every life that they can, or at least try to. Ways to take action to save a life include registering at your local DMV where you get your license that you want to be an organ donor, as well as your state. Inform your family and friends that you want to become an organ donor. Now, imagine a loved one needing an organ, whether it's a sibling, parent, significant other, or friend. All it takes is one person to have the right match for them. When you donate your organs, you are giving someone else a new chance, a new life. A part of you will be with them and will live on. Become educated, and you can help save a life as well. You can give somebody else a chance to live by making the one decision on becoming an organ donor. According to organdonor.gov, the success rate is 80%, depending on the organ. Yes, your body can reject the organ, but the chance of a transplant is very successful. 8,000 people will die each year unless more people become organ donors. 79 transplants are usually done per day, and kidneys are the most common organ that is transplanted. In August of 2017, 1,600 people are waiting for an organ. This includes men, women, and children. 95% support organ donation, but only 54% are actually signed up to be organ donors. An example regarding organ donation that I have personally seen is working in the PICU at Children's Hospital in Morgantown. I've seen many children that are brain dead and their parents decide to donate their organs to other children. It's honestly a miracle experience to watch, because the parents of the organ donor and the parents that the children are receiving the new organ, both parents usually are crying in happiness. I've witnessed this to a few occasions, and it's truly a miracle to experience. Organ donation is a selfless act that can give somebody a new chance at life, so I suggest you becoming an organ donor as well.